Hi everybody, and welcome to today's webinar that will explain or discuss the Swedish take on responsible antibiotic use. I'm who's speaking are Jessica Ekström. I work as a research officer at the Swedish Farmers Foundation for Agricultural Research, and I'm also a deputy leader in work package animal care in the project of EuroDairy. I would start to ask you all to stay muted so we don't hear your background noise. And you will be able to write questions in the question box during the webinar, and we will address the questions after my colleague Ylva's presentation, or my former colleague, I would say. My former colleague Ylva Persson, who will do the presentation today, is an associated state veterinarian in ruminant diseases at the Department of Animal Health and Antimicrobial Strategies at the National Veterinary Institute of Sweden. And she's also working as a consultant at Växa Sverige, which is Sweden's largest advisory health service for dairy herds. And here she is responsible for AMR matters. And she is also one of the main authors behind the Swedish policy for antimicrobial use in cattle. So I will leave the floor to you, Ylva.
Thank you, Jessica, and welcome everybody to this webinar on antibiotic use and antimicrobial resistance in the Swedish dairy sector. I work at the National Veterinary Institute, SVA, in Sweden. It's a governmental expert authority of infectious diseases in animals, and we work in 4 different areas: diagnostics, research, surveillance of diseases, and communication. And as Jessica mentioned, I'm also affiliated as a consultant for Växa Sverige, which is Sweden's largest advisory service company for dairy farmers. We provide Swedish dairy farmers with doses and technicians for artificial insemination. And we also have outsourcing services and consultants and veterinarians and other specialists working with advisory health. We also have public functions like the official genetic evaluation, the national cow recording scheme, and control programs against some infectious diseases, and also a Nordic cooperation for feeding. Before we start today's subject, I will just give you a brief background on the Swedish dairy sector. We have a little bit more than 300,000 dairy cows in almost 3,500 herds. The mean herd size is 92 cows per herd, and 70% of the cows are kept in free stalls, and the rest in tie stalls. The Swedish cow is high yielding. On average, a little bit more than 10,000 kilos of energy-corrected milk per year, and almost 40% of the cows in Sweden are milked by robots. And almost 80% of the herds are affiliated to the National Milk Recording Scheme. The 2 major dairy breeds in Sweden are the Swedish Red and White and the Swedish Holstein. We have a few herds with the Swedish Jersey and also some local indigenous breeds like the Swedish Mountain breed and the Swedish Red Polled. So, to work on antimicrobial stewardship, we need to ask ourselves, what is the right way? Is it through legislation, guidelines, or a total ban of antibiotics? Or are there other ways? In Sweden, we believe this is the solution. This is a photo of an old sign sitting on the door to a museum barn or a museum herd. It is almost 100 years old, and it says that this herd was free from tuberculosis and brucellosis. So already then we realized in Sweden that freedom of certain infectious diseases is the solution towards healthy and productive cows. At that time, we were obviously not aware of the problems with emerging antimicrobial resistance. But today we know that healthy cows do not need antibiotics. And our work on prudent use of antibiotics is based on what we call the Swedish model. And the basis of the model is animal welfare, since well-managed animals are healthy animals, and healthy animals do not need antibiotics. We also believe that it is important and also possible to control or even eradicate many infectious diseases. We were also the first country in the world to ban antibiotic as growth promoter, and we have since then continued to work towards prudent use of antimicrobials for treatment. And all this has been possible through cooperation and dialogue with all kinds of different stakeholders, from the government to the dairy farmer, to meet consensus. And we strongly believe that we should not create systems where antibiotics is a must. This is a graph of all antimicrobials sold for all types of animals in Sweden. And as you can see here, in 1986, we banned the use of antibiotics for growth promotion, which eventually led to an increase of the use of antibiotics, mainly in the pig sector. But after a couple of years, with better management and improved knowledge, we managed to decrease the use of antibiotics. Another important aspect of this graph is that you can see the blue lines. They indicate individual treatment and the yellow group treatment. And almost all treatments in Sweden are given to individual animals and to a lesser extent to groups of animals. So in order to reach low and controlled use of antibiotics, a composite strategy is needed. It's not possible to just do one thing. We need to do many things at the same time. But one thing we could start with is to remove the unnecessary use. And we have done that in the EU by ban use of antibiotics as growth promoters. But we should also try as much as possible to get rid of the routine prophylaxis to treat healthy animals with antibiotics. We should also minimize the need by keeping animals healthy and avoid spread of infectious pathogens by better biosecurity, infection control, hygiene, etc. Still, we believe that sick animals need to be treated, and then the use needs to be optimized. For example, by correct diagnosis, correct selection of antibiotics, and the optimal dose and treatment length. And finally, to monitor the use and antimicrobial resistance in order to set goals, follow up, and also do benchmarking between countries. And through communication and collaboration with all stakeholders, it is possible. And this Swedish strategy is a mutual strategy between the human side and the veterinary side. And the overarching goal of it is to preserve the possibility of effective treatment of bacterial infections in people, but also in animals. And I will go through all these bullets step by step and give you some examples from the Swedish dairy sector. And we start by remove unnecessary use. And one thing that we practice in Sweden and in all Nordic countries is selective dry cow therapy. It means that we will treat only cows with mastitis with antibiotics during the dry cow period. In many other countries, the so-called blanket dry cow therapy is practiced, where you treat all cows during the dry period. And that means that we will treat also healthy animals with antibiotics. And as mentioned earlier, individual treatment is standard in Sweden, both in cows and in calves, because group treatment will lead to the treatment of also healthy individuals. And the cows in Sweden are indeed healthy. They are free from many infectious diseases like BVDV, bovine virus diarrhea virus, IBR, paratuberculosis, brucellosis, chlamydia, leptospirosis, tuberculosis, bovine leukosis, and also with a very low prevalence of salmonella. The general fertility is very good. We have a low incidence of clinical mastitis and a low calf motility. The foot health is also good, with a treatment incidence of infectious foot diseases of around 1%, which means that 1 out of 100 cows are treated with antibiotics against infectious foot diseases every year. And from the claw health record, we also know that we have a quite low prevalence of digital dermatitis, below 4%. And I apologize for this graph in Swedish, but it shows the calf mortality. The blue line is for calves up to 60 days, and it's below 4%. And the other two are for older calves and young stock, below 2%. The udder health, which is the most important disease from an antibiotic perspective, is also very good in Sweden. We have a very low treatment incidence of clinical mastitis, below 10%, and we mainly use narrow spectrum benzyl penicillin to treat mastitis, up to 90%. The calculated somatic cell count is a little bit over 200,000 cells per milliliter, and the main bacteria, both for clinical and subclinical mastitis, is Staphylococcus aureus. And I will just give you some examples on how we work towards better health in Sweden. This is a slide of what we call the 5-2 diet to slim your cell count for better udder health. And I don't know if you are aware of the 5-2 diet, but you were supposed to eat for 5 days and starve for 2 days in order to lose weight. So we borrowed this to create a 5-2 diet for better udder health, with 5 routines for stop the spread of contagious bacteria. Contagious bacteria are bacteria that spreads from udder to udder, for example, Streptococcus agalactiae and Staph aureus. And 2 routines for environmental pathogens like Streptococcus tuberis and E. coli. And the 5 routines for contagious pathogens are optimal milking routines, TTIP, selective dry cow therapy, not blanket, but also to treat the right cows during lactation against clinical mastitis, and to group and cull chronically infected cows. And the 2 routines for environmental pathogens are good hygiene and to strengthen the cow's immunity. And this is a web-based program, sorry again for the Swedish. We call it Udder Health on the web, and I will try to explain it for you. It is a web-based program for individual herds where the udder health status of the herd is visualized by smileys and also a cake diagram. And the data is registered and in the cow control scheme, and it also benchmarked to all other herds in the cow control. So a red smiley indicates that this herd is among the 10% worst herds in Sweden, and the green smiley would indicate that the herd is among 50% best. So what we see here in this particular herd is that this farmer has got a cell count on around 300,000 cells. It also cost him or her some money. So this is the cost for udder health on this herd. How many cows that are healthy, 41% in this herd, and how many cows that are chronically infected, which was not good for this herd, 32%, and also how many cows that have a new infection. We have other web-based programs for better animal health. For example, Biosecured Herd, which is a biosecurity program run by the industry, for example, Växa Sverige, and funded by the Swedish Board of Agriculture. And this is a 3-level program, including self-evaluation on the web-based courses for farmers, but also courses held on the farm, and farm visits by veterinarians and other advisors, focusing on biosecurity. And other programs for benchmarking for animal health and welfare are the welfare signals and Ask the Cow. The welfare signals is again a web-based program based on data from the cow recording scheme, and again the benchmarks are visualized by smileys in different colors, where a red smiley indicates that you are among the 10% worst in Sweden, and green that you are among 50% best in Sweden, and yellow in between. So this particular herd, for example, has got a red smiley for young stock and a red smiley for management, but green smileys for feeding, diseases, and longevity. Ask the Cow is not based on data from the cow recording scheme, but on observations. A calibrated advisor will visit the farm and will ask the cow. That means that he or she will look at the cows and see the cow signals of animal welfare. In cows, young stock, and calves. And then the data is visualized not with smileys this time, but with flowers. And the goal is to achieve a flower with full petals. But this herd has got problems with lame cows and cows with wounds or other lesions. It's the same in young stock. Too many wounds and lesions, and the calves are too thin. So just to summarize this section on healthy animals, healthy animals will lead to, obviously, lower use of antibiotics, but also better animal welfare and easier labor for the farmer, because sick animals are time-consuming. It will lead to more milk of better quality and higher growth rates of the calves and the young stock, and more profitable dairy farming and higher consumer trust, including safe food. And moreover, healthy animals will lead to a lower risk for people working in the animal sector. This is a report from the Swedish Authority of Work environment. It was launched last week, I think. It's about work environmental risk working with antibiotic-resistant pathogens in the animal sector. And it states that many European countries exhibit a high prevalence of both MRSA, especially in pigs, and ESBL, especially in chicken and livestock. However, the situation in Sweden remains favorable, with very little or no occurrence of MRSA, ESBL, and VRE. And all these abbreviations are different resistant bacteria. So diseases can be prevented by identifying and protecting healthy cows and calves, and by identifying and minimizing risk factors. So it's better to prevent than to cure, but healthy, sick cows must be treated. And then we need to optimize the use of antibiotics. And in Sweden, we have guidelines from the Swedish Veterinary Association and complementary guidelines from the government and legislations. And if you are interested in our guidelines, you can follow this link, and they can be downloaded from the website of the Swedish Veterinary Association, and they are available in English as well. And the guidelines state that penicillin is first choice in most cases, and the legislation says that it should be a very restricted use of fluoroquinolones and newer generation cephalosporins, antibiotics that should be safe for humans. And I will give you some examples from the Swedish guidelines and how they are implemented in the Swedish dairy sector. And we start with the mastitis, which is most important. And the overarching guideline is that we only treat cases of acute clinical mastitis during lactation. So that means that all other cases of mastitis, like subclinical mastitis and chronic mastitis, are either not treated during lactation, or they are treated only with supportive therapy, like anti-inflammatory drugs, or the treatment with antibiotics is postponed until the dry period. If we have, I just must add that in all cases of mastitis, the veterinarian will collect a milk sample for further bacteriology. It means that we almost always know the causative pathogen of the mastitis case in Sweden. And if we have a gram-positive pathogen that is sensitive for penicillin, for example, most staphylococci and most all streptococci, then we treat with penicillin for 3 to 5 days. If we have a staphylococci resistant to penicillin, then we don't treat them with antibiotics, but only supportive therapy. And the same for E. coli. Then we don't use antibiotics, but only anti-inflammatory drugs and other supportive measurements. And for dry cow therapy, we practice, as I mentioned before, selective dry cow therapy, which means that we treat only cows with mastitis, and we do not treat healthy cows, and we do not treat the very chronic cows with continuous high somatic cell count, because they will have a very low probability to cure. And we do not treat staphylococci with beta-lactamase production that is resistant to penicillin. For infectious hoof or claw diseases like foot rot and digital dermatitis, we are moving away from antibiotics. Instead, we treat these cows with a local bandage with salicylic acid. And for reproductive disorders, we only treat acute clinical metritis with antibiotics, and then the first choice drug is penicillin intramuscularly for 5 to 7 days. And for pneumonia in calves, first choice again is penicillin intramuscularly for 5 days. And for calf diarrhea, we only use supportive therapy in most cases and no antibiotics, because calf diarrhea is mainly caused by viruses and parasites in Sweden. We do have some cases of bacterial diarrhea with E. coli F5, and then we use trimethoprim sulfa. We have stopped using fluoroquinolones to treat cases of diarrhea. And here are some examples where we do not use antibiotics. As I said earlier, most infectious claw diseases, most cases of calf diarrhea, and the reproductive disorders like retained fetal membranes and endometritis. Obviously, we do not treat viral diseases, and there is no prophylactic use of antibiotics in Sweden. And we don't use antibiotics to treat the majority of wounds or other lesions, and not for normal surgery. So finally, to monitor the use of antibiotics and resistance, we know that we have a very low use, a very controlled use of antibiotics in Swedish dairy cows. And here is an example of antibiotics used for treating mastitis. And as you can see, a majority is narrow spectrum penicillin with a little bit more than 90% of the antibiotics used. And we use around 10% trim sulfa and fluoroquinolones. And the treatment incidence of clinical mastitis is below 10%. And this is a graph showing the total use of antibiotics for all kinds of diseases in Swedish cows. The black line is for all antibiotic substances, and the gray line is for penicillin. And as you can see, the treatment incidence of all diseases is a little bit above 10%. I think it's 11 or 10%, 12%. And this prudent use of antibiotics, together with good biosecurity, have led to a very favorable situation of antimicrobial resistance, with few resistant bacteria in the dairy sector, especially when it comes to mastitis. And the penicillin-resistant Staph aureus, which is a huge problem in the dairy industry, is decreasing, and it is today it's around 2% for clinical mastitis. And this means that we can still use narrow spectrum penicillin to treat almost all kinds of diseases in dairy cows. And last year, the EU had a so-called fact-finding mission in Sweden to learn more about the Swedish use of antibiotics in the animal sector. And if you are interested, you can find it on the web. And it summarized that Sweden consistently reports the lowest use of veterinary antimicrobials among EU member states, and also relatively stable and low levels of resistance in animals. Overall, the report concludes that this situation can be attributed to a number of factors, including a long-standing awareness of resistance-related issues and actions to avoid them, the long-standing efforts to eradicate and prevent the introduction of infectious diseases in farm animals, the so-called Swedish model of consensus thinking, mutual support and cooperation between government, industry and other stakeholders, the monitoring and evaluation of trends in the development of resistance and the undertaking of actions before they become problematic, and the fact that veterinarians in Sweden cannot sell veterinary medicines they prescribe. And a number of aspects of the measures put in place in Sweden aimed at avoiding the need for antimicrobials and encouraging their prudent use when necessary could serve as an illustration of potential good practices to other member states. So just to summarize this webinar, prudent use of antibiotics is possible if you use antibiotics only when it's necessary and with as narrow spectrum substance as possible, like benzyl penicillin, and to avoid the most critically important antibiotics, for example, the fluoroquinolones, the newer generation cephalosporins, and the macrolides. They are, according to the World Health Organization, very important for the human sector and should be avoided or restricted in the animal sector. And finally, healthy cows is the key because they do not need antibiotics. Thank you.
Thank you, Ylva. It was very informative. We have received one question from Phil Gordon here. I will read his questions. He has a proven water-based safe technology. Oh, it wasn't a question. It was more an invite to contact the right person in the UK for AMR in dairy cows and sheep. We have a question here from William Waterfield. What is the overall culling or replacement rate in Swedish dairy herds or in Sweden?
That's a good question. I just know the figure for other health, and that is 8 or 9%. But I don't know the overall culling rate, but I know that it could be better. And I also know that the average age of the cows is a little bit too low. I think it's 2.5 lactations or something like that. I don't know if you know, Jessica. I'm not really a data person.
I agree with the numbers. I don't have the actual numbers, but the numbers you are mentioning is fairly accurate as I remember it. Actually, and we are working on that issue also to.
Yeah, we would like them to stay longer in the herds, definitely.
Yeah. And we have 2 questions from Charlotte Cunningham. We can start with the first one. Where were the figures you quoted? 7.9% mastitis. Oh, now it disappeared.
Maybe it was about the treatment incidence.
Yeah, the quoted were those figures national statistics, and do you have the access to national statistics?
Yes, they are from the national statistics, so they are registered. Each veterinarian needs to register all treatments, and then we get the data from the Swedish Board of Agriculture. So there will be veterinarians that do not register. So the true number is probably a little bit higher. We believe that we lose around 20% of the registrations, so it might be around 10%. But this is not the true incidence of clinical mastitis, because it's only veterinary treated cases. But since Swedish farmers in general are not allowed to treat their own cows with antibiotics, a majority of treated cases will be recorded by a veterinarian. So I would say it is fairly true, but probably a little bit higher, around 10%.
Yeah. And Charlotte is also wondering what the driving forces behind the antibiotic reduction are in Sweden, and how long have we been actively working to reduce antibiotics?
It started in the 80s, both with a ban of growth promoters, but also an increasing awareness of the problems with antimicrobials. And since then, the use has decreased, and the use of penicillin has increased. And the motivation has been that I think we are working together as both veterinarians and farmers. We want the cows to be healthy. We know that it is better to prevent than to cure. It has not been, we haven't had any real legislations in Sweden. So I think what I said about the Swedish model is true, that we have been cooperating and we have been communicating and met consensus that we want to do this together, both veterinarians and farmers.
I agree with you. But it's a cooperation. And William Coops, who is the head leader for animal care in EuroDairy,
I met him.
Yeah, is asking if you could tell more about the other health web. Is it obligated for every dairy farmer? How and by who are the data put in? And are the consequences for farmers? The question seems to disappear, Siobhan.
I can start because the other health on the web is available. So it's not mandatory, but it is available for all dairy farmers affiliated to the cow recording scheme. It is not open for anyone. It's not open for the general public or anything. So it's only for the farmer and the veterinarian with access to this particular herd. And the graphs and the information is based on data from the cow recording scheme. So everything is automatically generating these websites. So it will give the farmer data, both historical data, but also real-time data for his or her particular farm. So it's just, in the past, they got this data on paper copies, but today it is visualized it's web-based. So this is just one way to show the other health in the herd. If the farmer is more interested in numbers and graphs, they can change the view of the web program. So it's not necessary to see the smileys or the cake diagrams. I just show you one part of the web-based program. But it is available for all dairy farmers in the cow recording scheme, but not for them outside.
Yeah. And Phil is wondering, what are the latest Swedish annual costs for mastitis and foot rot to the economy, if we have that number? We had for the mastitis, it was like 1,300 Swedish crowns, or?
Yeah, I don't know.
No.
But mastitis and foot rot are costly diseases. So if you could prevent them, you will save money. But I don't know. I have no idea actually.
No. And it's both costly in the aspect of mastitis that you can't deliver milk to the dairy industry, and also for the veterinary costs. So it's in both aspects. And William is wondering, are there any restrictions on the number of treatments that the individual cows can receive in a lactation?
No. So, but our data on clinical treatment, treatment incidence of clinical mastitis is for all. It also includes repeated treatments. So if you treat a cow 10 times during a lactation, then it will be 10 registrations.
Yeah.
So it is not restricted in the legislation, but it is not advocated in the guidelines that you should treat more than, let's say, 2 times in a lactation.
Yeah. So. And Maria Åkerlind, the former colleague of ours, both of us from Sweden, is asking, regarding benchmarking with other countries, is it possible to compare antibiotic use for different animal types, for example, cattle, swine, etc.?
No, not today.
No.
But I hope it will in the future. The only true benchmarking is for antibiotic use in all animals, which is reported in the SVAC report every second year or something. But that is for all animals and not for separated species, unfortunately. And we have different ways of, I know that the Netherlands, they are doing a great job in registering antibiotic use, but they use they have other kinds of data than we have. So it's not really comparable, unfortunately. But I hope it will be in the future.
Mm.
We compare in the Nordic countries. In the Nordic countries, we have the same system, so then we can compare.
Yeah. And Charlotte is wondering if you have any advice for UK farmers. They are lowering their usage, but still need to work to meet their targets. And what practical advice can you give to farmers to reduce their usage?
The practical advice is this webinar, I would say. But I mean, you are all very welcome to contact me, and then I can provide you with what we have in Sweden. Most of it is unfortunately in Swedish, but we have the guidelines, and like this webinar, we believe strongly in keeping animals healthy and work towards better health.
To work from that angle instead of working from the other angle.
I still believe that we should have a composite strategy with also introducing and implement prudent use of antibiotics. But the most important part is to keep animals healthy.
Yes. And Charlotte is also asking if there are a single factor that you think has been the most responsible for reducing antibiotic usage in Sweden.
The most single factor. I think it is that our cows are so extremely healthy and free from diseases. And if I must say one thing, it could be the eradication of bovine virus, diarrhea virus. It's an important driver for antibiotic use, since it lowers the immunity and will lead to bacterial infections.
And then we have received a question from Nila. Thank you for the presentation. Do you have data on antibiotic use in poultry sector? It is difficult to treat the individual animal in this case.
Yes, and we use almost nothing in the Swedish poultry sector. We have data, and they are available on the web at the National Veterinary Institute. I think among 1,000 flocks, we treated last year only 5 flocks with antibiotics. In the rest, we don't use any antibiotics at all. Instead, we use good biosecurity, all-in, all-out systems and vaccination programs. But of course, we still use coccidiostatix, so in chicken. But apart from that, we don't use any antibiotics at all, I would say.
No, in poultry,
so,
no.
Yeah. It's a very limited use.
Yes.
Yeah.
And Derek is wondering, how is data on antimicrobial use collected in Sweden? Is there a system like VetStat in Denmark?
Yes, it is this. For antimicrobial resistance, we collect data in the SVARM system, which is led by the National Veterinary Institute. And data on use is also gathered from the National Veterinary Institute, apart from individual treatments in dairy cows, which I told before that then we get data from the veterinary recordings in the registration at the Swedish Board of Agriculture. So it differs a little bit, but the system is somewhat similar as the Danish system.
And Gineke is asking, if a cow must be treated, is a vet coming to the farm for each treatment, or is there sort of a short phone call and the farmer can treat the cow?
In a majority of the herds, the farmer needs to call the veterinarian for each case of disease event. But we have recently started with what we called delegation, or what do you say? What do we call it in English, Jessica? Vila. It's some kind of
veterinary voluntary. No, it's a
no. Anyway, it is a system. It's a little bit similar to the Danish system, where you have a farm veterinarian that's prescribed drugs, and only penicillin is allowed to the farmer, and then the farmer can treat cases of mastitis and foot rot and some calf diseases without calling a veterinarian. And then the farmer or this herd needs to be affiliated to this particular system, and they also need to have a special farm veterinarian, and this veterinarian needs to have health visits each month or something like that. So it is possible, but a majority of herds are not affiliated to this system, so they still call the veterinarian each time they need antibiotics. And veterinarians are not allowed to prescribe antibiotics over phone. They need to see the animal.
And if a cow must be treated, is the vet coming to the farm for each treatment?
Yes.
No, it was, yes, that was the,
yes.
You answered that, I agree.
Not each treatment, but each individual. So if the veterinarian, they start the treatment, but then the farmer is allowed to continue the treatment for 3 days. But if the cows get sick again in 2 weeks, then they are not allowed to just give a prescription over the phone. Then the veterinarian needs to come again on a new visit.
Yeah. Well, then I don't have any more questions on my screen. So if it's the last chance to ask Ylva. And you can listen to this webinar again if you want to on the EuroDairy website, and you will also get an email with a link to this. Now we have a question from Charlotte, is wondering if you have contact details for further information.
Yes, I mean contact details for me.
Yeah.
Yeah, but I don't know how to. I don't know how to provide them. If
you don't have any, no, you didn't have that on the. I can put it on. I can email Shimol. She want to put it out, but it's Ylva Persson with 2 S's at
Jessica. Sorry, if Charlotte emails her question to the email address AHDB she's received the invite for, we can then forward her question to Ylva.
Okay, great. Did you hear that, Charlotte?
But yeah. maybe there are other people that are interested in my contact details. So if it is possible to disseminate it, I mean, for me it's fine. I should have thought about it, but I didn't. I'm sorry.
No problem. If it's okay with you, Ylva, we'll include your email on the follow-up email with the recording. Perfect.
Yes, absolutely.
Great.
That would be great.
Maybe there are a lot of other who didn't were able to join the webinar that have questions for you. So, yeah. Okay. Then I don't think we have any further questions. I want to thank you, Ylva, for a very nice and informative presentation. And thanks to all of you who have been listening to us.
Thank you.
Yeah. Well, have a nice week and weekend, and I say bye-bye.
Bye-bye.